The best thing any government entity can do is get out of the way and have the appropriate policy framework with the right incentive economic system to fuel innovation.
Hi, everyone. Before we jump into today's episode, I want to take a moment to give a shout out to my amazing Supercast subscribers. Your continued support means the world to me. As a Supercast member, you get exclusive access to the unfiltered, ad-free video versions of our Health Unchained interviews. Raw, real, and packed with insights. You're not just supporting the show, you're fueling the conversations at the cutting edge of healthcare and blockchain innovation. So thank you for being a vital part of this journey. If you're interested in joining, you can learn more about Supercast in the episode description.
Hi, I'm your host, Ray Dogum, and welcome to Health Unchained. On this show, I will be speaking with healthcare entrepreneurs, thought leaders, and executives who are using blockchain technologies to revolutionize healthcare. These innovators are building the distributed infrastructure and diverse communities required for a trusted, secure, and decentralized healthcare ecosystem. Enjoy the show.
What is blockchain?
Was ist Blockchain?
What is blockchain?
The doctor will see you now.
Remember, the Health Unchained podcast is for informational and entertainment purposes only, and we are not providing any sort of legal, financial, or medical advice. Please do your own research and due diligence before making any important decisions related to these matters. And now please enjoy episode 128 of Health Unchained.
Welcome to Health Unchained. Today, we're joined by Nitin Gaur, founder and CTO of LedgerLink.ai, an innovator in bridging digital assets with traditional finance, and Jim Nasr, CEO of Acoer, a returning guest from episode 59. Good to have you back, Jim. Since at least 2020, Acoer has been a leader in developing secure, usable, and real-time blockchain solutions in healthcare. In this episode, we'll discuss the newly established charter for Decentralized Healthcare and Life Sciences, or CDHLS. As executive committee members, Nitin and Jim will discuss their roles and the opportunities for ecosystem development. For those unfamiliar, the Coalition for Decentralized Healthcare and Life Sciences unites global stakeholders from healthcare, technology, academia, and regulatory sectors to champion decentralized technologies that enhance healthcare delivery, equity, security, and global collaboration. Shout out to Tori Sanaj for helping to coordinate this effort under the Partners in Digital Health Organization. Without any further ado, I know that was a long intro, so thank you guys for holding on there. Nitin, why don't we start with you? Introduce yourself, and then we can get to Jim.
Thank you so much. Yes, it was a mouthful, and I would compliment Tori to stick along and progress the agenda for quite some time now. So Nitin, ex-IBM, I founded Blockchain Labs at IBM. That's when I interfaced with Tori and worked with the ecosystem around healthcare as well as financial services. And after 14 years of founding Blockchain Labs in early 2014, 2015, joined Wall Street firm State Street, looking as a global head of digital assets, drove the capital markets agenda, and then formed LedgerLink. And the intention of LedgerLink was to be able to integrate digital assets to the core or back office systems. I just exited that, so that's another interesting sort of nugget. But glad to be here, Ray, with you, and happy to share things I've learned and delivered in the past.
Awesome, and congratulations on the exit.
Thank you.
I'm Jim Nasr. I run a company called Acoer. I appreciate the introduction. We have been building healthcare and blockchain solutions for about 6 years now, full-time. Prior to that, I had a clinical research organization and built open pharma technology and also blockchain. And before that, I did CDC, starting with the blockchain story way back in the day. And actually, long time ago, I was at IBM as well. So I guess Nitin and I share a little bit. I appreciate you saying the CDHLS acronym, so we don't have to say it again, Ray.
Yeah, no, that's all good. Maybe we can get started with, what do you both see as the main driver behind CDHLS? Why do we need another organization like this?
One thing which I have seen across every industry needs a working group, a think tank of sorts, which brings in the thought leaders, the industry leaders, people who understand the industry to change things. Every industry is going through its own set of transformation. And I believe the CDHLS essentially was formed to bring in technologists, to bring in new technology, to solve some of the imminent problems that we are beginning to see now with healthcare. Actually, it's been in transition for almost over a decade, where there's a disconnect between healthcare delivery, healthcare information, and the entity who are suffering are the patients and all of us in between. And so I think this was formed to solve some of the Obamacare era, the Affordable Care Act, of figuring out this dynamic of healthcare information and ensuring that we are reducing all the cost elements that go with it, but at the same time ensuring the healthcare delivery is more meaningful to the patients.
Yeah, I think this is the time for us to revisit decentralized technologies for a number of reasons. So I think, certainly with the current administration, that there is renewed interest in crypto and a real drive. I think that in many ways has really kind of changed perspective and sentiment on decentralized technologies. Crypto, is a part of it, but it's a much bigger thing. The other thing, and honestly, this is the thing that I am most excited about, Ray, is AI, right? So AI is transformational. Everybody is doing it, wants to do it. There's no question. But then the very next question is, well, how do we do it responsibly? How do you do AI in a more ethical way? How do you do it in a way that's more verifiable, more sustainable? I think those are the kind of things that actually is very much part of the kind of the purview of this group. And if you look outside, there is, for instance, a decentralized AI society now, like just the last few months. Michael Casey's running that. We're talking to them. There's quite a bit happening around decentralized science, the DeSci space, even the DeSci AI space, also confusingly called DeSci. So, and I think what we're trying to do is actually be much more about implementation, like who is doing real work, what is the real work, and how do we use that as a way to provide infrastructure, not just learning. I think learning is great, but we all have access to ChatGPT, but infrastructure, connections, and actually highlighting real work. So to me, all those things have an edge to them. And it's, and honestly, over the last 6-7 years of building in this space, maybe outside of 2017-18, where there was an ICO craze, I think this feels different. So therefore, it's the right time for it.
Very interesting. And, this organization is not only focusing on blockchain, it is really about taking all modern technologies and implementing them in a way that actually helps the doctors, the patients, the insurance companies, everyone in this ecosystem do their jobs better, more efficiently, faster, and cheaper. I think that's one of the big promises of AI, to reduce the cost it takes to deliver good healthcare, not just in the US, but globally. There's a huge disparity between how much it costs to do a surgery here versus in a different country. So there's a lot of market fluctuation and pricing, and I think that can change as an outcome of some of these implemented technologies. Can you share some of the benefits to members? Members include companies or different organizations, could be technology companies, could be hospitals, research institutions. Can you share some of the members that are already part of the organization, what they're getting out of it? What are some of the benefits?
Yeah, during my IBM days, Ray, when we were working with this, when Tori initially, founded this organization, we were working with Aetna and Cigna and some of the healthcare life sciences, which is how we categorize this industry. And one thing which, if you look at any of these large corporations, there's a process. There's a process starts from innovation, then there's justification, then there's line of business selling that happens. And you do need a lot of material, both in terms of thought leadership material, which is what this organization sort of produces, but also there's a selling, right? Which means you have access to talent, Jim, myself, from different sort of walks of life who bring this together. And that material is then used internally to say, hey, this is what's happening in the industry. I think we should do something about it. So the members get benefit of access to material, access to thought leadership content, access to the business models that is driving the innovation and driving the disruption. And I broadly categorize this into two areas: transformation and disruption. The transformation happens gradually and disruption happens suddenly. But nothing happens suddenly. Things actually happen gradually till they happen suddenly. And the question is, how do we keep the various organizations in the loop? Because they have a business to run. And oftentimes innovation sort of is on the wayside. And how do you fold them into the entire process through this gradual innovation? And I think the entities like CDHLS provides some of the rails into accessing the innovation, the thought leadership, the talent, and all of us in the sense of providing our perspective and our vision as we engage with the industry in a meaningful way.
Yeah, you raise a good point because, as you mentioned, there's a lot of companies out there might be interested in this, they're learning about it, but they're also very busy. They have their full-time, daytime jobs. So being able to go to a resource with valuable information that's accurate, correct, and not just spammy noise, as you can potentially see in the crypto industry sometimes, is really valuable. Being able to find that good information and being able to rely on it, it's hard to find these days. So I could see that being very valuable.
If I could add, Ray, part of this CDHLS is to tap into people who are doing things for real, like I was mentioning before, but I'll give you some examples. So, and like we were saying, this is more than just blockchain. It gets into emerging technologies, but you need to really have a deep understanding to do it well. Nitin's point that, we underestimate what we can do, in like 10 years and overestimate in 1 year. I think Bill Gates said this is really true because all of us have been in this blockchain space for 6, 7, 8 years. And I think it's only now that we're finally beginning to kind of create some kind of resonance at a larger level. But I'll give you like a specific example. I am working with a prospect on a kind of a payments deal. But now we're looking at scale. So it's not just proof of concept, it's scale. But when you're looking at scale, there's all kinds of things that they have to consider and really have proven that you don't necessarily in a small way or theoretically. For instance, the mix of transaction types on the blockchain, such as the token craze versus NFT craze versus smart contracts, and how do you then financially kind of project it in a way that becomes sustainable in the bigger picture. So it turns out when you do that, and then you're looking at multiple protocols, it's actually fairly complex because many times you have to suspend your own assumptions because you've been using technology and it's this way or that way. And then there's also like nuances on how do you go about the architecture? For instance, do you use an NFT collection and many NFTs within it, or anyway, not to get too far down the rabbit hole, but having people who have actually done it and could say, look, this is a realistic model for building something sustainable. There is a lot to be said for that because there really is not a whole lot that's out there at that kind of scale. And to me, to us, this is the kind of value you can get, even if it's just talking to people like Nitin and myself. We're doing these kind of things for real because just not many people have done it at that kind of scale.
One thing which I think Jim instigated this thought process where we've all worked with payer networks. At the end of the day, there's a whole ecosystem of how money moves from insurance to the healthcare providers and pharmacy. And suddenly now, at least in financial services, there's the intersection that we've been talking about stable coins and tokenized fiat. So if that becomes a vehicle for us to move money in real time, what is the impact of what's happening in financial services industry, which is lion's share of my work, with lion's share of Jim's work, is how do we intersect the two together? It's not just about EMR, EHR, the healthcare records, which is still a different use case altogether. Is how do we cut short the 21 days or 3 months sometimes it takes to move money between the various aspects of this ecosystem to almost instant, which will also help the ecosystem in the industry. So I think that's where I think my head would go at. It's not happening in vacuum. These are all the interconnected systems that are at play.
And that actually speaks to the scale part of what Jim was saying. Like, how do we build these systems in a way that it can scale forward? Because if you're still dealing with slow payments and getting bank wires for certain payments, it can slow down the process of data transfer. So yeah. I could see that. And speaking of speed and scale for blockchains, do you both feel that we're at a point where there are reliable blockchains that can provide a Web 2-like experience and a Web 3-like level of security? Is that happening now?
Yeah.
No doubt, right. There's no doubt. I think that, yeah. I think to be honest with you, and I could, off the top of my head, just from work we've done, mention at least 3 next generation. Not only the scale and the speed and time to finality, which is the Web 2, like if you think about Visa, that's what you really care about is finality of a transaction, but at very low cost. The days of crazy gas for Ethereum and having no ceiling on predicting your fees, those days are likely over. And there's all kinds of layer 2. So I don't think that's there are other considerations you have to really take into account, such as governance. That's a really big thing. You have to really figure out what is the governance. Community, great. Okay, you have this fantastic technology. It's cheap, it's fast, but if you have 10 developers, 10 companies, Is that where you want to go? Or do you want to go somewhere where, like 10,000? Are you going to be EVM, Ethereum virtual machine compatible? So there's a lot of these more nuanced questions you really have to understand. But then I would say the big thing is when we talk about scale, this goes back to Nitin's comment about financial systems interacting with health. The paradigm really is no longer going to be us humans with machines. I think that, of course, is one paradigm, but there's going to be a lot of AI agents with AI agents. The scale for that is like 10,000 times more than a human to machine scale. You could easily have AI agents talking to AI agents, exchanging value, exchanging micropayments, like using tokens as example, all of which sell up at a higher level to a patient claim or something like that. But that kind of scale is very different to what we have traditionally been talking about in healthcare. It's exciting, but I think then this is going back to why you need an outfit like CDHLS, which is these are like brand new considerations. This is not like having my 1,000 agents work with your 1,000 agents, right? So we're already like a one-to-many relationship, and exchanging and working together and being secure, being verifiable, being low cost, being fast. Those are like new, interesting problems, but that's the reality of what we're looking at.
I would agree. I think, my focus has been a little bit more on technical side, Ray, where if you look at the advancements that blockchain itself did, this is things like zero knowledge proof and privacy preservation technologies, scalability technologies, figuring out how do we achieve scales at this massively decentralized infrastructure that's still relying on the internet. And then if you look at the innovation at the AI element, so the recent sort of, Blackwell, which is the chipset from NVIDIA, is now water cooled, and it's looking into focusing on three fundamental elements, which is compute, interconnect, and storage. You have this massive amount of data that gets created with every single patient visiting a doctor every single time. Can we use blockchain as a transactional framework? Can we use AI as analytical framework? Can we use sort of this privacy preservation technologies to comply with the likes of HIPAA and HL7s of the world? I think scale, to me, as Jim rightly pointed out, it's no longer an issue. I think energy is a bigger cost. There's a cost element to it. But I think technology, to me, is there for us to create data, disseminate data, abstract it from the transactional framework which blockchain provides. That's the kind of information I believe the entities like CDHLS can provide to its constituents, that it's no longer a complex maze. We can structure this and build a framework that makes it easy to consume by the CIOs of the member organizations, how to approach the industry.
Yeah, I think being able to help organizations kind of guide their hand or be able to explain to them certain strategies, why they would or wouldn't work, is really valuable, because they can waste months of their time otherwise doing the same research that you've already done. And this way, it kind of saves them time and helps the industry as a whole grow maybe even faster, more effectively. How does one become a member? If a company wanted to become part of CDHLS, how do they do that?
There's a form, there's a website, a dedicated side of the blockchain healthcare today. Tori Sinai, as you mentioned, she's the overall lead. Through Tori, myself and Tom as leaders in there as well, can be reached. There is a little vetting process, that happens as you would expect, just to make sure that, there's a fit, and you go from there. As soon as kind of early days, early is good for these kind of things because you can help shape it, right? Hopefully it'll grow where we have a lot of members, and then there's maybe a little more of a process to like the full membership. But right now we say it's those kind of contact methods.
It'll evolve over time as well as new members come in, have new ideas. So I'm definitely much looking forward to following. For anyone who is interested, I'll make sure to include Nitin and Jim's info in the show notes and the website and stuff. So it'll be easy for you to reach out and get more information on that, because this is actually very important, being able to communicate with other members of the industry, because this is not we can't be doing data silos anymore, right? There's got to be sharing of information.
And there is a value neutrality too, Ray, where you come together to solve industry problems, and you're not tied to the traditional sense of what both financial services and healthcare being regulated are not allowed to talk about. We can talk about problems. Second thing I would say, this pre-COVID, we used to have this small curated events where we could actually bring 100 people from the industry. Those are really, really good. I think we all collectively would learn from each of those problems. Of course, at some point, we got to bring that back. That was really, really meaningful for various audiences. Of course, COVID, like other events or other sort of events were affected during COVID, but we got to bring it back at some point.
Yeah, absolutely. I believe BHTY also has an event that they host. I think it's in Boston this year, so definitely check that out as well. So Jim, so I understand you have a specific work stream for CDHLS. Can you kind of talk about that?
Certainly. So my work stream is the real life implementations work stream. So really my objective is to find people like ourselves at Acoer who either have built or are building real implementations with healthcare innovation in mind and with decentralized technologies, whether it's a DeSci or some kind of patient health or health data reporting, which is what we do a lot of. That's really what I'm trying to do. There are a lot of forward-looking folks in the DeSci space, as example, that I'm trying to tap into. As all of us heard last week, with the 23andMe bankruptcy, that there's an awareness now of maybe more so than before, that having all of our genomic data, all this value tied to one organization that can be hacked, and largely create value for very small number of people at the expense of everyone. That's not a good thing. That we could use that more for clinical innovations and research. So there are people like that that I'm trying to tap into and reach and bring them in and share their stories, but also share their learnings. Honestly, I feel like there is a very significant leap that we are having and going to have for resetting learning because of the AI, because of agentic AI, because of needing to do tokenization, because of needing to do verifiable intelligence, ethical AI, whatever. There's some synonymous terms, but all that is kind of different to what we have done, and therefore there's, I think, finding those folks, highlighting them, sharing amongst each other, and then projecting out, reflecting out. That's like all that is quite exciting.
Yeah, for sure. And I'm glad that you mentioned what's happening with 23andMe. I'm kind of glad of what's happening in 23andMe because there's a lot more buzz around this idea of owning your own data, especially genetic information data. This is 15 million people, right? So it's a significant number of people that may start to be curious about why they should be owning their own data. So that's significant. What I'm seeing in the news mainly is how you should delete your data. This is bad. And I agree. I actually did 23andMe about 10 years ago with my family. And then last year at some point, I deleted my own data from their servers. I hope it went through. But you have to still trust. That's the issue. That's the core issue right here. You have to still trust the company is doing their job in protecting the consumer. Whereas if there was a decentralized cloud storage system using blockchain technology that is completely open source, and I'm able to click on a button and say, remove this or hide it or something, I can be a little bit more reassured that the math is the math and there's no way a person can make a copy or screenshot of this somehow. So there's that kind of thought process in my head, at least. And I'm just glad that the awareness is rising in terms of that.
And Ray, most of us may not quite understand, but 2020 revealed kind of like the problem that we have now, and it's a larger problem, certainly in the US. But if you just look around, look at what's happening in Europe, and Europe just enacted this law called the European Health Data Space. That's like the polar opposite of what's in the US, where patient data is gatekept by very few providers, EHR systems, and many intermediaries. In Europe, with this law, which will be enforced over the next few years, it's this whole idea that patient actually does own the data, does need to provide consent actively for sharing. If the patient, like you, Ray, wanted to delete the data by law, it must happen, and you must provide proof. That to me is kind of the direction we're going. Not in the US, and we have craziness with things like TEFCA in the US for patient data sharing, which is largely gatekept by very few entities. I think the force of public demand, particularly through these kind of 23andMe type revelations, and what is happening around the world, the rest of the world. I think those are positive things for all of us to get together and say, can we get ahead of this before we become the next CNN reveal or whatever before that becomes us. Can we do something so we're now really demonstrating that we can protect individuals' rights, individuals' data, and if you want to be forgotten, we allow you to be forgotten.
Yeah, so let me add some complexity to Ray, and I agree with all of you. In fact, I never went to 23andMe for this reason alone. I was not very sure, and DNA data is something which, at least now, especially now, with everything being faked and really hard to discern between what's real and what's not, is truly a challenge.
Sure.
But then, if you look at what we did with Right to be Forgotten in Europe, right, within the Web 2 land, to say, hey, Google is able to find all this information. If I choose to be forgotten on internet, I should be able to provide information to Google. And while Google is not an entity that curates your data, it is an avenue that finds it and makes it available. So all Google is doing essentially is severing those links, but the data is still lying in some website that they don't control, for example. And if you look at blockchain, there's an element in blockchain called immutability, which lends itself to the trust system that we all love and like about it. So there's a little dichotomy of that interesting challenge technically to say, hey, you're not supposed to delete anything because that lends itself to trust. But what can we do in terms of ensuring whether it's keeping a hash on chain or ensuring we have a zero knowledge proof setup, which allows me to sever the visibility of data. And those architectures and those thought processes have to evolve. And I believe if one thing that this organization done, people like Jim and us and the entire collective, is to provide the thinking behind those architectural framework and the thinking that embodies into the technical sort of underpinnings that drives that architecture forward, if that makes sense.
It makes sense. And I think for those that might not be aware, zero knowledge proof or ZK proofs are probably the killer app that we're going to be seeing the next couple of years in terms of privacy. And I think that's something that is hard to wrap your head around because we haven't been doing it like this in the past. It's been, you have to trust this centralized company or organization or institution to hold that data. And then if they delete it, you have to trust them. They're the gatekeepers. There's no other way around it. So it's really interesting to see that space evolving. So many use cases around how to use ZK or blockchain or NFTs in healthcare. What do you think are some of like the most lowest hanging fruit or the next, what do you expect to happen first? What are some of the most easy or simple use cases you can imagine actually working a mass amount of people?
Yeah, I'll start with the work we're doing, right? I firmly believe that this is one of the use cases because it isn't at the individual level, it's at the population level. With population health data, you have some other metrics in mind than you do with the individual. But all to say, really this idea of how do you do better sharing, exchange of public health reporting, public health data. So we saw this with COVID. We see it in our work with opioid prevention and kind of this whole overdose mortality and overdose reporting. A lot of that really is population level data where many times the PHI has already been anonymized or there are simpler ways around dealing with protected health data. So really you're talking about how do you share that kind of data amongst different counties, between counties and states and amongst the states and with the federal government, things like this. Relatively straightforward, I think. To implement blockchain with that and to provide traceability to as example, going back to this overdose and opioid prevention, to then use the proof of the data, whether it's around mortality or tracking like black market sales for fentanyl and things like this, to then tap into the opioid settlement monies. So working with law enforcement and different public health agencies is literally what we are doing. And this is when it comes to the economic impact and the human impact is very non-trivial. This is a very big deal. I think there's at least $10 billion just in the settlement funds, and there's a lot of other money in other places. Many people suffer from this, right? Like the overdose, kind of addiction or the opioid addiction and overdose related problems is a really big problem, and it impacts communities, it impacts, of course, counties and public health and caretakers, particularly when you have situations like civil unrest or like the LA fires, as example. It really largely impacts people. So I'm a big believer in that because in order for us to use some of these decentralized technologies and verifiable intelligence and things like this. At that level, it's a relatively more straightforward data sets to work with. It's less complications on how do we go all the way back to the patient. You have some more leeways, and the data is more accessible, even though it's private. So that's one that I definitely believe in. And, like I said, we put quite a lot of work in. I think Nitin and I were talking about this. I'm sure Nitin will probably expand on it. But areas around like payments, also, for instance, this pharmacy reimbursement problem, real problem, a lot of money. But again, it's a problem that is.
Can you explain? Sorry,
Yeah,
Jim. Can you
so
explain the pharmacy and reimbursement problem?
yeah, there's a few examples, but there's this thing in the U.S. It's called the 340B. It's a law. It's all to do with kind of transparency and on basically payment to pharmacies, and it impacts many of the independent, like smaller pharmacies, and it ultimately comes back to proving transactions you've had. Many pharma companies have reimbursements, but oftentimes the PBMs get in the way, and there's like weird kickbacks going on, and CMS and other government agencies want to have proper reporting on it. So it's kind of a siloed data set problem, but it's a very big scale and requires you to provide transparency on certain things when you reconcile, when you're doing payments, making claims, and the intermediaries are involved. So that's, again, to me, there's a few use cases that are relatively more, I would say, more ready for decentralized technologies than, for instance, how do we incentivize patients directly to provide their clinical data for clinical research. I think that's a more complicated one. That I think that requires a lot of offline things to still, be kind of be done a little bit differently, and maybe incentivizations to be a little bit different. The contracts may be different. I'm optimistic it will happen in time. Maybe not in the U.S., but in the U.S. There's several use cases already.
Yeah, I couldn't agree more with Jim. I think he touched a lot upon these things. And my perspective, Ray, is there are adjacencies in digital asset space that's evolving. So I mentioned payments, stablecoin. Stablecoin today have reached, close to about 248 billion in overall market cap. They're constantly being used for cross-border payments. They've been used now for, in some cases, in building liquidity pools. So it's becoming more and more mainstream. And suddenly now, if I have ability to, instead of giving a bank account, give wallets. So there is that adjacency in payment or financial services that can be exploited. The other thing is around supply chain. We've been at this using DLT and blockchain technology to streamline the information asymmetry that exists in supply chain ecosystem. So if I were to take the adjacency and bring them into the healthcare ecosystem, you have pharmacy, pharma, and the entire operational framework of it, but there's also an interface with the patient. Then you have the insurance, the payer-payee ecosystem that manages the movement of money between the healthcare providers. Then you have the healthcare providers, the clinics, the hospitals, the doctors. And then you have the technical, the healthcare information systems, which is the Cerner and the Epics of the world who are providing. So it's like a complex web of ecosystems, and they all have a mechanism to the economics that play in who gets paid on doing what. There's already a fragmentation, but I think in the immediate terms, we piggyback on successes of adjacencies as a near term. I think the longest thing, for many reasons, right, if you look at the emergence of ACA, was there to solve the data problem, to be honest with you. And I went through the entire sort of bill to understand what is it, because I was working with healthcare industry at the time, was really to reduce the duplication of all these tests and ensuring the data is easily available, which means that I can go any doctor anywhere and they would have access to my data for them to be able to provide appropriate prognosis without having to go through another set of tests and so on and so forth. So healthcare information, I think, for various reasons, political, regulatory, the existing interest of healthcare information service providers will be the last one. At the same time, I don't think we can rely upon, just like what we've learned from crypto, again, another adjacency, rely upon the wisdom of people to manage their own data. I don't think many of them are ready to jump on the Web3 ethos of owning your own data and monetizing it, no matter how good it sounds. So there'll always be an intermediary. The question is, will they be new intermediaries, or the existing healthcare information intermediaries become the newer intermediaries to provide you access, and then your ability to rent your data for analysis and get paid for it, or getting an insurance break because suddenly now insurance company has more information data, they get your health. It's not a blanket insurance premium. You're given insurance based on your health profile.
And the idea of being able to keep your data secure the whole time is also another challenge in all this. You hear about data breaches and everything. So that's another part of that I think might be a more readily available, like just securing the data somehow. I'm with you in terms of patient health information itself is going to be at least 3 to 5 years down the line in terms of becoming more widely adopted. And for the reasons you just mentioned. One thing I'm wondering, what should be the federal government's role in helping to manage healthcare information? What should be their role in helping to speed up the adoption of this sort of technology?
So I'll reiterate what I heard from one of the government officials, and that shall remain unnamed. The best thing any government entity can do is get out of the way and have the appropriate policy framework with the right incentive economic system to fuel innovation. And oftentimes, at least in my career, and I'm sure Jim, love to hear your perspective on this as well, that any heavily regulated industry, financial services and healthcare, people always piggyback to, oh, this doesn't allow you to do it, or HIPAA doesn't let you to do it, or HL7 is too restrictive a framework. I think the best thing the government can do is a policy framework that gives enough room for experimentation and removes some of the barriers that could be an impediment going back to a much more stringent regulatory framework, which we begin to see now loosen up a little bit in crypto land.
Yeah, those are good insights, Nitin. I mean, from my perspective, I'm going to reflect on what has happened and some things that people have said. So I mentioned Europe with the EU that have done the European health data space. So that's a number of federal governments basically saying, we're going to have these laws, and ostensibly it's about protecting individuals' rights, patients' rights. I like that. I think that's needed, especially for us here in the US, where we're wasting so much, I mean, basically $1 trillion a year in so many things that are duplicated or gate kept. And the opacity is many of the problems that we face, whether it's as individuals or providers, is because of that built-in opacity and the government effectively not putting in standards that are accountable enough. So in that way, I like that. What I don't like is where, for instance, with AI, with ethical AI, where the technology is evolving fast and regulators are trying to over-regulate things they really don't understand. I think that can create a trickle-down effect of stifling innovation. Again, going back to Europe, they have some ideas around this, but some of it is extremely restrictive. And if you compare US versus Europe, I've talked to clients and some colleagues in there. The big concern is we're over-regulated on things that are really evolving as we speak. I like the idea of I like what FDA did at the beginning of this year, where they had this draft guidance on AI saying, look, if you're going to do AI on patient data and there's a patient safety element, that AI needs to be explainable. You need to provide traceability. I like that. I think that's good. What I didn't like was that they didn't go far enough to provide more of, this is what we've seen work, such as use cryptography to do it, as opposed to do the traceability by having an association of people. You know, and I've seen some of the comments that people have provided on that guidance, and it's like, well, FDA, how much more money can you provide for us to do this? Or, what, can we set up another regulatory body for doing this? To me, that's not the answer. The answer isn't to say that the problem is this, but let's create more siloed entities to solve it. I think it requires, if we really want to do more explainable AI, where is the technology going and how do we do it at a scale? I think there are some good things. I think the regulators, in my opinion, are generally well behind where the technology is. But in this case, the technology is moving so fast that they can't have that 10-year lag cycle. They really need to be actively involved. And fundamentally, I also don't like this idea that we're going to have one giant database for everybody's health. I think that is completely impractical. It's really, in so many ways, pie in the sky. And so I don't think that's the solution.
It sounds like, Jim, you are expecting the government to be a little bit more prescriptive on how to use specific technologies in order to implement these more secure ecosystems or frameworks.
I
And you
would
mentioned
like them to
cryptography.
be more prescriptive, as in if
Not
you
totally prescriptive, but just a little bit more.
yes, but if you identify the problem, don't leave the next step as just do more of the same and you'll fix the
That's
problem.
right.
I think that's really what I'm saying. It's like to me, if we have an AI explainability problem, that is not a problem that we're going to solve by having a committee of people.
That's right.
We need a better solution for it.
That's right. I'll piggyback on that, what Jim mentioned. That's such an important point. If you look at GDPR, which is the privacy regulation in Europe, they had, and it's been a decade, almost a decade, where they've had this framework around who gets to do what with data. Suddenly now AI has popped up. And there's a clash between what technology can do and what regulation allows you to do. At some point, technology always trying because technology knows no bounds. It's going to move on. We have to figure out as to how do we build the guardrails around it instead of trying to regulate the technology, which is what many of the European Union had done because they have to preserve the GDPR instead of looking at GDPR and saying, can we change this so that we can take advantage of AI as opposed to let's change AI so we preserve GDPR. And I think that's an interesting dichotomy of thought process to say, how do we domesticate the technology with the right guardrails so it's not harming people, as opposed to regulating tech itself. But maybe it's a biased opinion from a technologist. I'll leave it at that.
No, that's a good point. I appreciate that very much. Many people are involved, of course, many organizations, different interests, stakeholders. And obviously, when politics is involved, you can get some really interesting decisions being made. We'll have to watch out for that too. I just want to say before we end here soon, Nitin and Jim, really appreciate your time. I think it's really important for this conversation to keep happening. For those that are listening, I want you to check out blockchain and healthcare.today or .com to read more articles on this sort of thing. If you're interested in the actual CDHLS, there's a coalition tab that you can click on the website. Before we conclude, I do have one final question for both of you. I know this is a healthcare technology podcast, but I also like to know how my guests stay healthy and fit. So I would like to know, both of you, what do you do on a daily or weekly basis to stay fit and healthy?
Yeah, I'm a big believer in if you're going to be preaching health, you got to practice some of it. I do quite a bit of cycling these days. I used to play soccer at a pretty high level, but try to avoid high impact sports just to be able to keep going. Quite a bit of cycling, and I'm a big believer in cold water immersion and ice. So I try and balance being active and doing active exercise with some things that help, kind of chill me out.
Yeah, I always end my showers in the cold, so I feel you there, Jim.
Yeah, no, it's great.
I haven't gotten the cold tub yet.
It's funny because, Jim, I used to go to this program called Bowl Community, which sources a bunch of leaders from around the world, and they have a week-long event in Austria. And you go to Austrian Alps, and they make you sit in this water for 3 minutes. I'll tell you, the first time I did it, I had energy for the whole day. And people could say, like, what happened today? I'm like, I don't know what happened, but you're just bursting of energy. But to answer your question, Ray, from my perspective, I have a simple formula. Eat better, meditate at least 30, 40 minutes a day, even if you break it into two different, when you wake up and before you go to bed. And exercise. I used to run a lot, but my knees are hurting, so I try to get some exercise, whether I walk for an hour or I at least go and do some. Because I think, and spend some time with family, and my family's part is in India, part is here. So I spend some time back and forth. Because those few things are, to me, mental health is first, and then eventually comes down to your ability to deal with physical health. Both are dependent on each other, which means you can't have one and not have the other. And so I've had that balance act, as Jim mentioned.
I appreciate that answer. I'm curious, are there any specific techniques you use for meditation, or is it more just mindfulness and you have your own
I think
system?
It's like anything else, got to train yourself. I did this program called Art of Living. Of course, coming from India, meditation was ingrained into our schooling system, and as we grew up, except I never understood what it was till I actually got older. And so I think the Art of Living basically teaches you breathing technique, and just like our minds on our bodies, you put garbage in, you get garbage out. And one aspect of this is training your mind, ensuring that you have thoughts come into your head that you have to acknowledge, and you have to figure out a mechanism where you are able to sit in one place in the state of being and not think anything. And it takes some time to practice that, Ray. And I think one of the programs that I did was using breathing techniques to figure out how do you not have any thoughts come to your mind. And believe me, it's a monkey. The moment you think about it, there'll be all kinds of thoughts that come to your head, and that's the hardest thing to do. Is training your mind not to do it.
Yeah, the monkey brain, right? And it's a talent to be able to stay in the present moment for an extended period of time.
Yeah.
So I appreciate both answers. Anything else you'd like to share before we conclude here today?
No, thank you for having us, Ray, and I appreciate your style. You bring the best of us. You're comfortable. We speak our minds, which is great. So thank you for your time as well.
I appreciate that feedback.
I echo that, and it's great to have you back. I think we need more people like yourself who are curious and really working in this health decentralized technology space. I think I'm optimistic that there are things happening around the world with some of these technologies and decentralized science. We need to have more conversation at a deeper level. So it's great to have people like yourself nudging that.
Yeah.
Thank you. And I know since the last time we spoke on the podcast, Jim, there's been thousands, if not millions of more people in this space. So it's been growing. So we've been doing our job. Appreciate what you're doing too. For everyone listening, we hope today's conversation inspired you to think critically about the future of health innovation and the role we can all play in building systems that prioritize trust, transparency, and efficiency. Don't forget to subscribe, share, and leave a review to help us reach more listeners passionate about revolutionizing healthcare. Until next time, stay healthy, stay innovative, and keep your mind and ideas unchained. Thank you both. Thanks, gentlemen.
Thank you.
Thank you.
Hey everyone, we would greatly appreciate it if you can take a moment to share your thoughts about the show by writing a review and rating the show on your podcast platform. Your feedback helps us reach a wider audience and enhance the overall quality of the show. Don't forget to encourage your friends, mentors, teams, and students to tune in and subscribe as well. Thank you for your support. Check out healthunchained.org and subscribe to the show on Spotify, Apple Podcasts, and wherever else you enjoy podcasts. Join the premium Health Unchained Supercast community by going to healthunchained.supercast.com, which gets you access to ad-free episodes, and join the official Telegram community group for the latest updates.